Hi, everybody. I wanted to talk today about major depressive disorder. Understand what it is, how we treat it, and some of the causes of major depressive disorder. A lot of us know everybody has some depression at some point in their life. It can be chronic or it can be transient, very temporary, depending on the cause. But major depressive disorder is the classification. It's a mental health condition that causes a person to feel sad, hopeless, uninterested in things that used to bring them joy or their hobbies. They just lose interest and don't want to do those things anymore. It can affect how people think, how they handle daily activities, and just how they feel in general about everything. It's more than just feeling down or feeling blue for a couple of days. These symptoms need to persist for 2 weeks or more to be classified as depression. And it can show up with some different diagnoses. Major depressive disorder can be just a single episode, one period of depression. And this is what a lot of people sometimes go through, maybe after a loss of a loved one or a significant trauma event. Recurrent depression is several episodes over time. Then you have a persistent depressive disorder, also called dysthymia, which symptoms last for 2 years or longer. It's more mild, but it's still chronic. Then we have postpartum depression, which a lot of people are familiar with, which can happen after childbirth, usually due to hormonal fluctuations. And of course, lack of sleep from having a newborn, among other things. There is seasonal affective disorder related to the seasons, where it affects people mostly in the late fall and through the winter, having to do with just general being more isolated because of the weather. It's colder, there's less sunlight, those kinds of things. And then there's depression that has psychotic features. These can include false beliefs, which are called delusions, or seeing things that aren't there, which are hallucinations. The most common symptoms of depression, and to be diagnosed with major depressive disorder, people need to have several of the following. So multiple of these symptoms: feeling sad, empty, or hopeless, the loss of interest in pleasure or activities, fatigue or low energy, trouble sleeping or sleeping too much, changes in appetite or weight, could be weight loss or weight gain, either eating more or eating less, difficulty concentrating, feeling worthless, feeling guilty, and thoughts of death or suicide. And symptoms must last for at least 2 weeks and affect your daily life. So what causes depression? It can have many causes, and sometimes it's more than one thing. It could be biological. Your brain chemistry, hormones, genetics all play a part. Life events like the loss of a loved one, stress, extreme stress, trauma, medical issues like a chronic illness. Some medications can even cause depressive feelings, and substance abuse like alcohol or drug misuse. And often it's a combination of factors. It's not just one thing or the other. So how do we treat depression? There are many treatment plans, and they are always individualized per the individual with their provider. And they can include medications, they can include therapy or combination. So the talk therapy, the psychotherapy, there's a couple different types. There's cognitive behavioral therapy. This focuses on helping people change their negative thought patterns, teaches them how to notice those unhelpful thoughts like I'm not good enough, and replacing them with more realistic, balanced thinking. They also include goal setting and practicing new behaviors to improve one's mood. Then you have interpersonal therapy, which focuses on improving relationships and communication with others, helping people understand how things like grief, conflict, role changes, and stress, like becoming a parent, may affect their mood. And teaches them skills for expressing those feelings, helping them solve problems and building support. We often use medications called antidepressants to treat depression, which helps balance out or correct brain chemicals and hormones. Lifestyle changes, exercise, healthy eating, and sleep habits can all help improve metabolically how one feels, which can improve depressive symptoms. And there's other options. There are support groups and brain stimulation therapies like EMS and ECT for severe cases. TMS, I'm sorry, not EMS, and ECT for severe cases. I want to talk a little bit about the medications used to treat depression now that we've talked about the different modalities of treatment. These are going to be the most common ones, and I'm going to try and pronounce all their names correctly. I'm not the best at it, but we have sertraline, which we commonly know as Zoloft. It is an SSRI, and I'm not going to get too much into their classifications, but it's just a nice little tidbit to know. Some common side effects with Zoloft could be nausea, headache, and sleep changes. Fluoxetine, also known as Prozac, is also an SSRI. It can cause some anxiety, restlessness, and dry mouth. Venlafaxine, also known as Effexor, it's an SNRI. It can cause dizziness, sweating, and may have some sexual side effects, maybe a decreased libido. There's bupropion, also known as Wellbutrin. It's an NDRI. It can cause dry mouth, insomnia, and increased energy. Amitriptyline is a TCA. It can cause dry mouth, drowsiness, and weight gain. And side effects usually do improve over time. They may only be persistent the first couple of weeks while taking the medication, and they will improve. And it may be that more than one medication is needed because one may just not work quite all the way. And taking these medications, they can take 2 to 6 weeks to be effective, to start really feeling a difference. And it's important when taking any antidepressants to not stop them suddenly without talking to your provider. Stopping some of these medications abruptly may have worse complications and side effects than tapering them down. And follow up with the provider, your doctor, whoever is prescribing, to monitor for side effects and to adjust dosages if necessary. And it may be that the medication's not needed long term. It may just, you need a little bit to get you through. And if you are feeling depressed, haven't reached out to a provider or anybody for help, please do. Please seek help. If you are feeling sad for most days, multiple weeks, you've lost that interest and that joy. If you have any thoughts of self-harm or suicide, you can contact the Suicide and Crisis Hotline at 988. You can text that number. You don't actually have to talk to somebody. You can go on their website, start an online chat. There's multiple ways to get help. So please, if you or a loved one or someone you know is struggling, please pass on that number to them. Again, it's 988, and I hope you all have a fabulous day.